Pain in the neck and near the edge of the scapula, as well as limited head rotation, can result from problems with the levator scapulae muscle. Watch the video to the end to learn the causes of these symptoms, exercises for quickly relieving discomfort at home, and helpful tips for preventing recurrence. I'm Dr. Chernov. Thank you for your like and subscription, and enjoy. The levator scapulae muscle is located beneath the upper portion of the trapezius muscle. Its fibers attach superiorly to the transverse processes of the upper four cervical vertebrae and inferiorly to the vertebral border of the scapula. Specific areas of tension, or trigger points, located in the middle portion of the muscle and closer to the vertebral border of the scapula cause pain at the angle of the neck and the vertebral border of the scapula, which sometimes radiates to the back of the shoulder. The levator scapulae muscle, along with the upper portion of the trapezius muscle, is more often affected by trigger points than other muscles in the shoulder girdle. The central trigger point at the angle of the neck can be located by palpation in a comfortable sitting position with your back pressed firmly against the back of a chair and elbow support, or while lying on your unaffected side. Palpation can be performed through the trapezius muscle, or the trapezius muscle can be slightly retracted posteriorly to expose the levator scapulae muscle. While lying on your side, turn your head to the opposite side to stretch and elevate the levator scapulae muscle. The success of palpation will directly depend on how well the overlying trapezius muscle relaxes. In addition to referred pain, trigger points in the levator scapulae muscle significantly contribute to limited cervical spine mobility. Pain when turning the head toward the affected muscle can be so intense that it forces a person looking back to turn their entire body, not their head. Active head rotation can be used as a diagnostic test for levator scapulae muscle involvement. Normally, when turning the head, the chin should be level with the anterior surface of the shoulder joint. If the muscle is affected on one side, limited head rotation, accompanied by pain at the end of the movement, will be observed to one side. If the levator scapulae muscle is affected on both sides, head rotation will be limited to both sides. Trigger points also limit full scapular movement during deep breathing and significantly contribute to shortened breathing, in which the scapula is relatively immobile. In a 1993 study of 22 patients at a New York orthopedic clinic, 95% had a site of marked tenderness approximately 2 centimeters from the superior angle of the scapula, which, when pressed, caused or intensified the characteristic pain. 73% of patients had nodules or a characteristic crunching sound in this area. The levator scapulae muscle, affected by trigger points and in prolonged spasm, transfers excessive load to its attachment sites at the transverse processes of the first 4 cervical vertebrae. This can lead to poor nutrition in this area and deformation of the cartilaginous structures, leading to the development of protrusions and herniations in the cervical spine and increased symptoms of cervical radiculopathy. Trigger points are most often activated and persist for a long time as a result of maintaining the shoulder in an elevated position with complete shortening of the muscle itself, especially if it is fatigued or exposed to hypothermia. This condition can occur, for example, during prolonged periods of computer use with a mouse and loss of proper posture, or as a result of carrying a bag on one shoulder for a long time, causing the shoulder to rise to prevent the strap from slipping. It's especially important to note that occupational activity and long-term stress significantly contribute to damage to the levator scapulae muscle. This includes prolonged computer work for programmers or accountants, as well as sales managers dealing with a constant stream of clients, if the conversation takes place over a telephone rather than using a headset. Playing the violin, flute, and a number of other instruments also leads to prolonged muscle strain. Watching a movie for long periods in a chair with high armrests, which elevate the scapulae and shorten the muscles, can contribute to trigger point activation and the development of neck pain and stiffness. Situations in which a person takes on increased responsibilities over a long period of time, so to speak, taking everything on their shoulders. Constant psychological stress, aggression, and hostility also significantly contribute to the development of prolonged muscle tension and trigger points not only in the levator scapulae muscle but also in the upper trapezius and other neck muscles. If a person, for various reasons, uses an improperly selected and excessively long cane, this will inevitably lead to neck problems over time. Intense physical exertion and excessive physical activity over a long period of time, such as swimming, tennis, or excessive handstands, can also trigger the development of characteristic pain. Car accidents and other whiplash injuries very often lead to the problems described above. Scoliosis, lower limb length discrepancies, and pelvic asymmetry lead to overload not only of the quadratus lumborum muscle, which I discussed in this video, but also to long-term stress on the levator scapulae muscle. Various viral infections, such as the herpes virus, can activate latent trigger points in the levator scapulae muscle and cause pain symptoms throughout the illness, sometimes persisting for several days after the infection has resolved. Trigger points located in the sternocleidomastoid muscle are more responsible for severe head tilt than those in the levator scapulae muscle. The sternocleidomastoid muscle has already been thoroughly reviewed. You can watch it here or by following the link in the description of this video. If you have a levator scapulae muscle injury, you can self-treat by applying strong mechanical pressure to the trigger point area, followed by muscle stretching. You can massage the levator scapula and surrounding muscles yourself using double massage balls, a single massage ball, a percussion massager, or other neck massagers. If you're using double massage balls, first very slowly move the double ball up and down your cervical spine near a wall for 1 to 2 minutes. During this exercise, you may hear a characteristic crunching sound coming from the muscle affected by the trigger points. Find the painful area of increased tension. Hold it there for 30 seconds and then massage the muscle again dynamically. An even more intense massage can be performed while lying on the floor. Place your hands behind your head and very gently massage the neck muscles. Be very careful not to put strain on the cervical spine. Also, if you have long hair, avoid letting the double ball roll across it, as this can cause you to pull out clumps of hair. If you're using a single massage ball, it's most convenient to work the levator scapulae muscle using the same principle, leaning against a wall and using your body weight. Be sure to perform the exercise on both sides. When using a percussion massager, massage the entire neck area with either a U-shaped or ball attachment, focusing on the most tense and painful areas. When using a roller massager, first set the large roller to the highest position and massage the neck area for 1 to 2 minutes. Then, turn the massager over, grasp the handles, lift your pelvis off the floor, and intensely massage the levator scapulae, upper trapezius, and posterior neck muscles. Just like with double massage balls, be careful with long hair. It's best to tie it back into a ponytail at the top of your head. If you're using an electric neck massager with a warming function, be sure to turn it on. After mechanically stimulating the trigger point area, the muscle must be stretched. We know that the levator scapulae muscle elevates the scapula by internally rotating it. When the scapula is fixed, it contributes to lateral head tilt and also rotates the head. If both scapulae are fixed, the muscle contributes to cervical spine extension. To stretch the muscle, abduct and lower the scapula by extending your arm toward the floor, turning your head to the opposite side, and then tilting your head laterally. To intensify the stretch, you can use the opposite arm. This procedure should be repeated with varying degrees of head rotation to stretch all the fibers of the levator scapulae muscle. Hold the final position for 1 minute. Be sure to repeat the exercise on the other side. You can also use post-isometric relaxation, whereby during inhalation the muscle contracts, counteracting the effort of stretching it, and with a slow, smooth exhalation, the muscle relaxes completely. You can also create even more favorable conditions by stretching under running warm water in the shower. If the stretching is performed in a sitting position, which is preferable to standing, you can sit on the hand on the affected side, thereby firmly stabilizing the scapula. Another good exercise for stretching the levator scapulae is lying on the healthy side without a pillow, allowing you to tilt your head to the side and turn it. With the hand on the affected side, grasp the bottom of the bed, increasing the stretch. After working on one side, be sure to complete 3 to 4 cycles of full active muscle movement and repeat the exercises on the opposite side. The levator scapulae muscle, like all neck muscles, is sensitive to cold and drafts. This should also be taken into account during rehabilitation and as a preventative measure for possible relapses. At the end of the workday, it's a good idea to apply a heating pad or hot pack to the trigger point areas. When sleeping on your side, it's crucial to choose the correct pillow height to keep your head in a neutral position and avoid prolonged strain or overstretching of the neck muscles. If you have trouble turning your head to the side, in addition to the levator scapulae, you should also examine the splenius, medial scalene, iliocostalis cervicis, rhomboids, and trapezius muscles for trigger points. You can watch detailed reviews of these and other muscles in this playlist. Thanks for liking and subscribing. I'd love it if you shared this video with your friends who suffer from neck pain. Stay healthy and see you in future videos.